try this. Sure, that makes sense. So once again, I'm appreciative of being here and having a crowd to speak to and just kind of like offer a different point of view and or a different, I like to think of it as a modality towards treating people who are suffering with musculoskeletal deficits, musculoskeletal pain, and or dysfunction. So I'm talking about this thing called exercise, and it's sometimes a scary word and sometimes a vague word. And ultimately, it's a form of movement towards a goal. And exercise, for people who don't exercise, it can be very scary. For people who do exercise, they do it right, it may bring them more energy, more an elevated mood, more focus, less pain, and the ability to carry on an active lifestyle, which might mean play with your friends or your family or go on vacations, or if you have a demanding job at work, it allows you to stand up all day and or spend a lot of time doing things that are physically demanding. So corrective exercise therapy software is essentially a software as a medical device to kind of meet people where they are and elevate the quality of their musculoskeletal system. No matter whether they just suffered trauma, whether they have chronic joint pain, whether they have an autoimmune disease, or rheumatologic disease, or just had surgery, doesn't really matter. It's the musculoskeletal system that has been, functioning at a suboptimal state, and it needs help, needs assistance. So the objectives of this talk tonight is really to introduce a musculoskeletal program into the lives of people who want more from their healthcare providers. And the goal is to stay active and be as happy as possible, positively impacting their rheumatic disease, if that's what we're talking about, autoimmune disease, a systemic disease affecting the musculoskeletal system in a negative way. Because it might affect other systems, obviously, but like me as a specialist in the musculoskeletal system, this is where I like to stay in my lane. But the goal is to inspire, facilitate, motivate, and empower people. And in this medical community, it's really the doctors caring for the patients. It's the providers, and maybe if we're not all doctors, it's providers caring for patients. So I don't know if the forward button is. Just a few seconds about me. My name is David Neuman. I'm a board certified orthopedic surgeon. I specialized in arthroscopic surgery for 15 years or so, treated a lot of traumatically injured people. So the inflammatory response was of the acute nature, and even modifying the acute response to trauma is something that's beneficial to patients. And I know that a fair amount of you do not treat acutely traumatized people, but chronic inflammation, I know it's a little different animal, but it still manifests with this similar type of thing, like increased blood flow, stiffness or loss of motion and mobility, and warmth, and then ultimately loss of function and pain. And so I've also been a patient, so I've been through that recovery phase of not being myself and being active. I had my ACL reconstructed, I've had shoulder surgery, and I actually stopped operating because of an old thumb injury. So arthritis is real for me, or it's part of my life, but it's really a post-traumatic degenerative osteoarthritis rather than a rheumatologic manifestation to the musculoskeletal system. So I maintain my passion to help patients and people stay active in a manner in which they can. So there is a big burden of musculoskeletal disorders, and I think, the rheumatologic diseases that do have a manifestation in the musculoskeletal system do fit into this category. It is a burden because it does negatively affect people and their livelihood, happiness, and or their productivity in life. So there's the aging crisis, not crisis, the normal aging of people, and it's around 10,000 of them that turn 65 every day. So there's a tremendous amount of people, and as we age, of course, we don't heal as well. We lose our balance. We lose a few key components, and we might be more apt to suffer the manifestations of an immune-based rheumatologic disease. So life expectancy is around 78.6, declining since 2016, and even declining more since 2020, when taken as a whole. But there's about 3 out of 4 people at 65 and older suffering from a musculoskeletal disorder. And I'm lumping this together as a osteoarthritic and other arthritic, rheumatologic, autoimmune, and the like. So it's about 127 million Americans suffering. So I'm sure people on this call, you've either had some joint pain, or you have some joint pain, or your parents or loved ones are suffering with some sort of joint pain. And it costs a tremendous amount of money in the United States, around $874 billion. And that's picked up federally by us taxpayers, as well as corporations and even private payers. So people suffering from rheumatic diseases that affect the musculoskeletal system are like other musculoskeletal sufferers or people with deficits, and it's a loss of function in the musculoskeletal system. It's just not doing what it's supposed to do, which is giving us support and stability and function and an active lifestyle. Joint pain. So there's 360 joints in the body, so some of them can be hurting at any one point. And as we age, it's more likely that 1 or 2 or 3 are. And there could be a loss of balance. So when your musculoskeletal system is not functioning well, you run the risk of falling. And falling can be a strongly negative projector of the rest of someone's life if they were to fracture, dislocate their shoulder, have a traumatic brain injury, and something like that. So loss of balance can come with just disuse. Too much pain, don't go out. They staying in bed for 3 days. You lose up to like 30% of your muscle mass. And so it's not great to lose your balance as you age, or even some young people in the office that you say, can you stand on one foot? And that they have to hold on. It's frightening sometimes. So when you have these rheumatic diseases and you just cannot function well, you do lose your independence. And so that puts another burden on the family and on the loved ones and on themselves. Chronic medical conditions become worse when someone can't be active. So anything like heart disease, high blood pressure, diabetes, asthma, obesity, high cholesterol, these things get worse if you don't stay active. But sometimes it's hard to stay active when you're just suffering with pain and a chronic low-grade or even high-grade inflammatory response. So these are problems that are rampant around the country and or world. And sedentary lifestyle has also been a big part of the last 2 years, that we're increasing our sedentary lifestyle, whether it's because gyms are closed or we're on lockdown, or we just spend more time on the couch because there's so many interesting or not television programs to watch. And a lot of our work is done on the computer, so we are spending time sitting. And so this sedentary lifestyle is increasing a lot of problems on the human body. And whether it's increasing a certain number of cancers, or increasing low back pain, or obesity, and all those negative things. So then we think of joint pain. So I think it's ubiquitous, joint pain, because whether it comes from a traumatically injured musculoskeletal system, or one that has chronically been beaten down by your own immune system, or negatively impacted by a virologic disease or parasitic disease, or anything regarding the rheumatologic system. So joint pain is troublesome, and I'm sure if you guys have pain, you want to get rid of it as fast as you can. And when you have it for a long period of time, you're just not yourself. You can't focus on work, you can't focus on your home. Maybe you project your frustration on your family, your friends, your loved one, your coworkers. So it's not a great state to be in, chronic pain. So there's a human cost, and it includes this list here, such as depression and pain and suffering and damaged relationships, drug dependence, as we know with the opioid crisis and the fentanyl that's out there, and or even like tramadol has now been like touted as being worse than oxycodone because of its increasing your mortality rate over time. But it's a prolonged and costly treatment with chronic pain, injections and therapies and pills and all that stuff and surgeries. And surgeries don't always help. It's a great modality, but it's never been touted as a cure for a lot of joint pain. So it's a great treatment for the right person at the right time, but expectations have to be understood. And in order to optimize outcome, there's really, one major thing, which I think is exercise. So reduced productivity is also a side effect of joint pain, lost independence, as we discussed, and diminished morale. So you can't be yourself on the dance floor if you've got a lot of pain. You just lose your prowess in the places that make you feel good. So then we're going to talk about this thing called exercise, and it does not mean that you have to do jumping jacks and squat thrusts and deadlifts and all this stuff that people might mistake as exercise. And you don't have to go to like CrossFit. You don't have to go to the gym and spend 2 hours doing something to maybe hurt yourself, or maybe make you feel better, or maybe overpressure your joints too much, or cause a tendonitis. So exercise is a very vague word, and it means a lot of things, but the studies continue to show the benefits of some sort of exercise, and there can be a right exercise for the right person at the right time to help build that goal of lower pain, more function, more happiness. So as you see the list here, and it combats chronic disease, it slows the progress of dementia, which is an interesting one. That means that when you increase the blood flow to your muscles, and we know we live in our body is a circulatory system, it also increases the blood flow to the brain, gets rid of those toxins and those cobwebs that are in there. It elevates your mood. You go out for a run, or even you just and I think even if you lift your arm to the ceiling 50 times, that'll increase your heart rate, and that will ultimately give you a little more energy. So it increases energy, prolongs your independence, and that means you're not dependent on things, whether it's a home health aid, whether it's a walker, whether it's a cane, whether it's a pill or a shot. It prolongs your independence in this world, or your loved one, or your family member, or your patient. So by doing the right exercise, you can rebuild strength, mobility, have less pain, stay more active. It alleviates pain, certainly been shown time and time again. And there's a big misnomer, even in my office, when I see people with chronic or within 3 months onset of pain, they're like, oh, I stopped using my shoulder because it hurt. And it's more like, well, now you just kind of let that scar tissue build up and that inflammatory process take hold of your shoulder instead of gently moving through it, increasing blood flow to your joints, revitalizing the cells, bringing back some of their health. It also reduces falls. So exercise, if you have balance and coordination and you don't try and do too much, you will reduce that fall. And like I said, when you're over 60 and you fall, if you have any fragility in your bones, you run the risk of fracturing them. If you hit your head, you run the risk of having a traumatic brain injury, which can alter your lifespan or your health span forever. And then exercise has been shown to lengthen life. So it's like I said, generic word exercise, but it does have these benefits if you do the right stuff. Or if you encourage your patients and you know them and you see what they can do, you encourage them to do some exercise. So I work with a company that deals with population health management technology. So in this audience today, your population might be those people suffering with rheumatic disease and or chronic inflammatory arthropathy. And population health management technology is for patients, is for people with joints, and such that there's over 500 specific joint health activities and controlled exercises to choose from. We call them corrective exercise therapy because whatever deficit one might have in their musculoskeletal system, by introducing an action item such as exercise, you can positively impact your influence on the patients and impact your patients' experience with you, experience with their disease, and everything like that. So we've pre-programmed and pre-packaged these exercises into about 65 different groupings, depending on what body part, which extremity, what qualities of joint function you're trying to increase. So they're joint specific and muscle specific. But we also go back to root cause, such that we offer a lot of balance, posture, coordination, and endurance type of exercises for those small muscles that are important to keep your alignment intact. So they're fully customizable as well, which means we want to meet people where they are and increase the quality of your musculoskeletal system. So it's called PopDoc. It's popdoc.com, and PopDoc is it's a company I started, and I work with a doctorate of physical therapy and an exercise scientist. So we bring a three-legged stool to a solution to musculoskeletal dysfunction. And PopDoc is it's not a dual acronym. It's really a three-phased acronym. And so it's both post-operative program documents, preventive orthopedic program documents, or prevent orthopedic procedures, direct your own care. So it allows people to take hold of their musculoskeletal system and do some action items. So it's very easy to follow, such that these are photographs and or GIF animation format. Simple, easy to follow. The text is either English or Spanish right now, and they're uniform images with a human model. And the goal is to bend two curves. We diminish pain, or we lower that curve, and we maintain or increase function, so we increase that curve. And it is impactful because we want to make a difference in the people that you care for, your loved ones, your family, because we believe that the right exercise done over a period of time, as long as it's done repeatedly in a regular fashion, not every day, but it could be every other day for 10 to 15 minutes, doesn't have to be too much, but it's a subscription service for individuals, families, integrative medicine providers, functional medicine, health coaches. We track and monitor user usage, engaging, motivating, and empowering people, and a great supplement to the inspiring care that you offer. Like I said, there could be big pharma, there could be homeopathic, there could be just lifestyle alterations such as diet and nutrition. But adding an exercise regimen that's tolerable by your patients is going to be very beneficial for you and for them. You bring more value to what you're bringing to the table for them. And it integrates easily and opens communication between caregivers and families. So you can share any of the data or anything that you have your patients on with their other caregivers or with their family members if they want to. So through integration, there are key results from using a platform such as this. So it's easy to use, engaging, effective service, accessible almost anywhere. It maintains and preserves a healthy musculoskeletal function as much as we can. Now, I know that people suffering from chronic rheumatologic disease for decades are not necessarily going to have the healthiest joints, but potentially, and I'm an advocate of thinking that we can slow the progression of some of their pain and dysfunction. So ultimately, higher patient satisfaction brings more patients into your office. It also keeps the same patients coming back because they like what you have to tell them and the way you make them feel. Staying active, feeling less pain is my goal, and hopefully it's the goal of you and maybe even the patients you care for. And improving the quality of life is one reason why I went into medicine, and musculoskeletal is just so intricate and satisfying when you come to get to know it really well. So together we're stronger. I'm a huge advocate of collaboration and believe that we come from experience. We're built with integrity, offering clarity and execution to help patients continue to use their joints so they feel better, stay as active and independent as possible. Doesn't have to be that 1 or 2 hours a day in the gym either. It could be as little as 5 or 7 minutes a day, changing lives forever. Healthier joints make happier people. And I think that with all the research going on and all the knowledge that's out there and the data that's being collected, that is a true statement. So I know it was a little different than what you guys maybe are used to at this venue, but I am appreciative of you listening to me, and I'm certainly open to answering any questions, taking any feedback, comments, or anything of the like.
Well, thank you very much, David. Thank you for taking the time. And if we need more information about maybe implementing some of your programs in our own practices or venues or even ourselves, how does one go about it?
So what I'd like to do is, let me see if I can do this thing here. So let me share one more second. It's a live site now. It's very forward-facing business to consumer right this minute, but this is the homepage. So we affiliate with providers and rehabilitation facilities. So our exercises, as I showed you on the presentation, this is kind of how they look.
Mm-hmm.
So they're all simple, easy to follow. And if you look at exercises, so it's a subscription model, so it's very reasonably priced. It's not supposed to be very expensive. And we are a healthcare technology startup such that we are working on optimizing our product, but it's essentially you can choose from any joint in the body, just about. And for those people who are not functioning very well, you can go to regain. So that allows people to regain any joint in their body regarding their neck or their wrist, elbow, hip, ankle, knee, low back, core. So anywhere where someone has deficits and you want them to work on, just even if it's just range of motion, it could be these exercises come down to their smartphone through an invitation by the provider. So the provider invites them by email or a text and then chooses whichever exercise grouping they want to. All these exercise groupings are customizable. So if you only wanted to give somebody 4 or 5 exercises, you can customize this group and make it 4 or 5. My team is available to work with any or all of you, and my email is at the end of that presentation. I could certainly put it in the chat as well, to have an onboarding or a deeper conversation about how to integrate this into your practice in a way that's feasible for you. My team wants to help facilitate that. And ultimately, it's
Can you
ultimately.
show us I'm sorry, can you show us a video of what's going on? Like what we just saw, like a video of like pain dot like points in the last slide on the body. And so
Yeah.
can you
So
show us like a
sure.
video of what kind of exercise would be involved, like if these are the joints to be involved?
Sure. I think I understand your question. So what I'm hearing you say is, can I show you?
Can you demonstrate it? Yes. Can you like actually demo it?
Yes, I can. So I'm logged in right now as an administrator. So when I go to my exercises, it comes up to these exercise groupings here on the right side. So there are so these are the exercise groupings that are already put together. And so there's around 650 of them. So depending on, these are already like the groupings that were put together. So let's say you wanted somebody to regain their ankle flexibility. These would be the exercises. So this is the list of all the exercises. So there are 9 exercises here. So they can easily just choose the one they want to do. And it shows you how to do this exercises. And it's written here on how to get there, like position yourself on your hands and knees. Knees should be apart at hip width. Sit on your buttocks back as the model is doing here. So
these are not videos, these are just
as
pictures?
Of now, that's right. They're GIF animations. So they cycle like they are now. And they tell you where to start and where to finish. And then it tells you how to get there and what to do. And then when you're done, you go to the next exercise, and then it goes through the seated bilateral hamstring stretch.
Is there like a pointer sheet for posture correction? Because most people even trainers do a lot of these incorrectly. So there's not like, I don't see a tips for, optimal positioning or like,
Well,
correcting for.
it's all, so as a healthcare tech startup, we are in our first round of raising some capital to put some audio on a couple of these images, create short videos to, some people like to see a video, but I think that when you see a video, you take your mind off of your own body and you don't necessarily focus on the way to do it correctly. But so if you look at the seated unilateral hamstring stretch, and the text is sit on the floor or exercise table with your involved leg straight out in front of you and the other one bent out to the side as the picture shows. Keep your back flat and lean forward, reaching both hands forward with the involved leg. So yes, it is technically precise in the verbiage, and it could be in an audio fashion as well, fairly easily. And then the technique is such that you're supposed to, first get to know the stretch. And some practices I work with are rehab facilities. So they have a coach or a physical therapist that's with them, showing them how to do the exercise. But a lot of it is you look at the image, you read the text once, and you learn how to do it once, and then the next time you go back, it's easier to do. So that you are learning new things, absolutely, and you're doing it in a way that's safe and effective. So if you're looking at how to do this one, you start in this position, and then you lean into your leg. And so it says here, so it's not verbal right now, but it's more text and imagery, if that makes sense.
It makes sense what you're saying. I just want to give you a background. I'm a physiatrist, so just from a perspective, not even as a like a physiatrist, or because it's 2D and our body is in 3D. In terms of perspective, like we're not exacting in the way that she is standing if everything is on one plane, if that makes sense.
Sure.
Yeah. So that if patients are doing it with their legs randomly at 45 degrees or some other degrees, and you're not getting an optimal stretch where they could do something that injures themselves. So you're not showing a 360 perspective with like a grid even. So it's not, it's a little challenging for me. And also because not all the patients can, not all the patients, if you're in pain, you're not going to be want to read. I'm sorry.
Yeah, I mean, that makes a lot of sense, and I appreciate your feedback. And it's, if patients are in a lot of pain, then regaining ankle flexibility might not be the one for them, but it might be something more like just doing some motion activities, like regaining ankle motion, which might just be easier to start with as a starting point, like to write the alphabet, which is something that they can just do, or pumps and circles, which might be easier for them to understand when it comes to what to do and how to do the exercise. But I appreciate your feedback about three-dimensional and grids, because sometimes there are some companies that have you strap things on and track each moment in 3 dimensions, and so it doesn't always lead to a better outcome when it comes to what the goal is. So like an ankle dorsiflexion motion when you're seated is a fairly straightforward thing, and people, yes, they have to learn something, but I think it's very worth it to learn something. And so if they say, okay, you sit down and you bring your toes to your head, towards your face, and then you bring it back down. So this is some feedback I will definitely take to heart, and I appreciate You. Thank you.
Yeah, absolutely. No, I just came from a startup space today, so and we went through a whole bunch of this stuff. So that's why I'm giving input, because also in terms of even something like dorsiflexion or plantar flexion, you can also go more towards the fibular side. Did you want it more even? Did you like there's other factors into play, so that's why it needs to be optimized is I think what I'm saying.
Yeah. But for dorsiflexion, it is essentially,
because otherwise you're going to create strain patterns. Like if the knees aren't, in a straight and they're more in valgus, and you do it in such a way and it doesn't explain it, and you're going to create more of a valgus, then there's going to have like a
well,
sorry.
No, but if you think of dorsiflexion around your ankle, the only thing moving is your ankle. Whether your knee is internally rotated or externally rotated or varus or valgus, the ankle motion is still a up and down motion. Now, if you don't have the muscle balance to achieve that, you can be pulling in certain different directions. And like this is a specific motion of dorsiflexion. But if you wanted to go for plantar flexion, it's also the only thing moving is your ankle. Like your knee's not, whether you want to, you can do it with a straight knee also, as long as you're just moving your ankle in plantar flexion. And if you're doing it like a seated inversion, so whether your knee is straight or not, or in varus or valgus or internally or externally rotated, you're still just moving through your ankle with this specific exercise, which is simpler than the hamstring stretch on a stool, certainly, which is why having coaches or a physical therapist walk people through the exercise grouping once or twice, and or having it on a video feed would be very beneficial.
Yeah.
How do you, David, how do you put together a program for somebody who comes in? What are some of the parameters?
So it's much of the way that the software has been used is through a provider of some sort, a healthcare provider, whether it's a physical therapist, a physiatrist, an orthopedic doctor, or rheumatologist, whomever it might be, to understand the patient and where their pain is and where they're suffering, to therefore create a customized program for them. And so it's usually, you got to walk before you run. So it's about doing some range of motion or even some muscle activation exercises that just kind of stimulates muscle contraction through some isometrics of some sort. And so whatever you think your patient can tolerate and what they can do and how they follow directions, or how apt they are to, let's say, read. So to create like muscle activation through isometric plantar flexion, it does take some conceptual knowledge to understand, oh, I'm just trying to turn my muscle on, stimulate it to contract, so it increases blood flow to that area and or increases its strength.
So what's a good session, say, for we want to build their quads here?
Yeah, so getting full range of motion of the quads would be step one, and then just turning on those muscles and slowly building them up. So in the quads, if we're thinking about the quads, it's either going to be through the hip or through the knee, and probably through the hip through some straight leg raises in 1, 2, or 3 planes to build quadriceps strength. So for condition and strengthening of the hip, let's say, there's some sitting or standing hip flexion, extension, abduction, adduction to kind of get that hip joint working. And then there's a lot of straight leg raises, either an external rotation or straight ahead. And they kind of, once again, they're laid out in that GIF animation to show you a good starting position, a good finishing position, and then the how to get there is all in the text, and will be verbal and or short videos to show the arc of motion, as Ching was mentioning before, how important it is in 3 planes.
So is this available like to us as a practitioner as a subscription, or
Yes.
is this just a prototype or?
So we are in development and optimization phase. So as a subscription service, it's around $1 a month per patient. So it's very reasonably priced because we want to get some feedback, and we also want to encourage your patients to do the exercise that's right for them. And my team is here to help either onboard your staff or even interact with some of your patients who might need to walk through the program. So the physical therapist I have working with me and or the exercise scientist would spend some time making sure that the patient has their 5 or 6 exercises that they know how to do them correctly.
And you usually limit it to that 5 or 6 at a time?
Well, we slowly progress as time goes on, but I think, swallowing 5 or 10 exercises, depending on the motivation of the patient and how much pain they're in, and or how avid they are and desirous they are to feel better, 5 to 10 is probably very easy to swallow once a day for 2 weeks, and then we move to something a little different to keep them interested and also to work on different muscle groups and or different planes of motion.
Okay, so you encourage them to do some sort of exercise every day then, right?
Yeah, absolutely, because we're not having them do jumping jacks and go running and do things like go up, and some of them, they can't get up and down on the floor too easily. So depending on the patient, it's like 5 or 7 minutes a day doing something to increase the blood flow to their extremities, and that will increase the blood flow to their brain and kind of ameliorate and facilitate a healthier lifestyle.
Okay, can they pick and choose their own also? Or do you block that out? So
the individual like direct to consumer, like somebody wants to come and work on their own ankle, they can, certainly. When it comes from a provider, we like to think that the provider has a better understanding of the patient and regarding what might be best for them. But we can also, as a provider, you can also give them 6 or 8 different groupings to choose from whenever they want to. So they can almost be like a buffet style for them.
Okay.
So it's unlimited. It's an unlimited number.
Dr. Bill, do you mean like create a program like automatically for like every 2 weeks to upgrade them in terms of muscle grouping, and then so to progress them? Is that what you're meaning?
Well, I'm just well, all right, David, here, I'll give you a specific example. L4, L5 disc herniation was operated on, a little bit of weakness left in the left lower extremity. The physical therapist says, okay, you're able to go on your own. Now, I'm assuming now this would be the time to take over here, so we don't lose what's been gained. And okay, so now what do I do?
Yeah, so it works as a supplement to physical therapy, meaning when they're with the therapist, the homework or the electronic prescription for exercise is offered by the therapist to the patient. But if the therapist doesn't know of this product and doesn't utilize it, then they say, all right, you're done with PT, your sessions are up, your insurance is up, you want to continue with your strength and your flexibility, let's say. The strength is an integral part of outcomes after lumbar spine surgery. Is how strong can you get your core? So we can either go with a maintenance program of some sort, where people can maintain what they have already, and we're in the hip right now. But if you're in the low back, you can do almost anything when it comes to so low back and core. You can work on wherever they think they are. If they want to work on their flexibility, they can. There's a maintenance program that allows them to maintain their integrity of their muscles around their lumbar spine, depending on where they are in their trajectory towards healing. So early on, it's about just controlling the inflammation, getting rid of the pain, and then working on muscle activation and or range of motion and flexibility. And then you want to go towards the strengthening towards the end. So we can certainly create programs that are progressive in nature, that every few weeks it kind of changes up automatically, or when you think they're ready, you give them the next set of exercises.
Okay. Okay. Okay, anybody else? I don't see anything in the chat. Anybody else have any other questions or?
I have a question. I noticed in the intro for this program, you had mentioned that this type of exercise therapy would be helpful to supplement pharmacological and homeopathic remedies. Are you yourself using homeopathic remedies? And the second part of my question would be, if you could add a homeopathic element to this exercise program you've designed, would you do it? And the third question would be if you could combine an acupuncture type of therapeutic without the needles and homeopathics as two adjuncts to what you already have, would you do it?
Yeah, absolutely. I think it's it's a multimodal approach towards musculoskeletal optimization. It's kind of like some of these treatments for, let's say, tuberculosis or HIV. They're using a cocktail type of thing, using different modalities and different mechanisms of action in order to achieve a higher result. So yes, I absolutely would in any or all of those scenarios.
Yeah, not right now, but I would love to contact you about that, because that's what I deal with, the homeopathics, acupuncture, and the osteopathic element. And sometimes it could be added very cheaply, very, very cheaply and simply. And you already have a structure here. So if your structure was to utilize a couple of more things like that with ease and safety, we might try to do that. Appreciate it.
Yeah, no, that would be cool. I'd love that. I think it'd be awesome. So what I'm just going to do is I'll put my email in the chat. That's probably the best way to reach me. I can also, you can also have my phone number, but I'm almost always on my email most of the day. And so collaboration such as this is really, I think, how we make a bigger impact on the people we serve. And I know I know that our software is very comprehensive and very robust, although it might not be in its optimal state at this moment. And as I appreciated Ching for bringing up some three-dimensional aspects or voice or short videos, which are not hard to make. And we already have that in our pipeline once we raise some capital. And getting early adopters or a collaboration of sorts will make a bigger impact. So yes, thanks, John. Appreciate that.
Thank you.
Hey, John, how do you do acupuncture without needles?
I do it transdermal. I call it trash.
Yeah.
I have the trash therapy.
If you don't,
Let's see now. Transdermal. Let's see. Got it.
don't-
The term I use that isn't offensive is acudrops, and those are homeopathic solutions which can be customized. So we can have a wide range of what and how we're treating. So those homeopathics are then placed in homeopathic driver solution and placed on acupuncture points. So you get the benefit of the acupuncture and the homeopathic. And it's been around about 100 years, but not many people have heard about it. Once you see it at work, it's kind of mind blowing because it's probably the cheapest therapy on the earth. Yeah, transdermal is how we do it. So instead of dipping a needle in homeopathic solution, we simply create a solution that's transdermal and place that drop on the acupuncture point. Very fast. So instead of spending an hour for a therapeutic session, you might spend 2 to 5 minutes and get the same results or similar.
Okay. All right. So I don't know. I've been doing acupuncture for 30 some years. Puncture usually is needles.
Yeah. So it's
don't mind us, David. We bicker like two old hens. So
no, I think you guys both bring up good points, you know, and John, if the homeopathic gets through the skin in such a way and it does get to those pressure points, then it's, you know, it's great. I think it's you know, these modalities are so important and helpful to patients, and that's why I think there are so many out there.
Yes. And by the way, trash is transcutaneous, anatomically specific homeopathy.
Right. I think you just made that. I think you just made that.
No, it was called with the the international thing, United Nations type of stuff. It was called homeopuncture. That's the old term.
Right, okay, that I've heard before. Yes.
There you go. We just don't use needles because we've learned how to get through the skin. So one of the possibilities is to turn the homeopathics into a nanostructure. So then we don't even need a driver to put it through the skin, but the nano itself might be enough to activate the point. We don't know yet. We need to try that.
What about like ionophoresis? You know, that's a
different thing.
That driver through the skin.
It's too much work.
Okay. Anybody else have any questions, comments? Next week we have Dr. Joseph, James Joseph from Dr. Halas's group's going to continue on with our COVID nanotechnology discussion. If anybody wants to, David, thank you so much for your time.
It was great to be here. Thank you.
You're welcome here. We're here at the same link every week, same time, same station. And for those of you that are new or don't know, I'll be sending out in the next couple of days. The website is just about done for our Congress of Medical Excellence 4.0. And this year we're going to Las Vegas. We're leaving Reno. So I don't want to hear any excuses about it's 2 plane rides, because it's not 2 plane rides to anywhere in the US from to Vegas. We're going to the Flamingo Hotel, March 25th to the 27th. I still have openings for speakers. You know, our main topics are rheumatology, autoimmunity, hormone replacement, anything cannabis, practice management. And we still need speakers. We need attendees and also sponsors. Anybody who's, you know, got a company, David, that'd like to present. We are 24 AOA CME Category 1 credits, and I'm going for the AMA credits this year. I think I'm going to be able to get it. So it's a little bit more expensive than Reno, but it's not too bad. We have a great rate for hotel rate. I mean, unbelievable. Considering the way anybody's been in a hotel room anywhere in the last 6 months or so. I got probably under $400 for 4 nights and over a weekend. So which is just almost unheard of anymore. We'll have our usual fun and surprises. Those of you who've been to our conferences before know we always do some fun things after hours. We are usually considered one of the best, contented, interesting speakers, and everything is current and up to date. We don't let any of those staid, MDDOs and drones. We don't let them in. We stop them at the door. So, I'll see if I can find some of the comments from last year. And last year we hooked on at the end with the second day with the Nevada Osteopathic Medical Association, and I got comments such as finally make CME credits worthwhile. Best day conference day I've had in 20 years. Things like that. So we do a pretty nice job. The AOA doesn't like us very much, so we have two hands tied behind our back. But as you can tell, those of you who've been getting the emails and listening, I've been putting the Integrative Health Alliance first. So for you don't know, David, we applied this summer to change our moniker to from rheumatic diseases to integrative medicine, and they didn't want any part of that. So we're just going to have to work around it. So, but
well, good luck with that.
Well, we're managing. So
yes,
we have a really nice core. We have a core of regulars here, and we like to thank them all: Dr. Patel, Marie Fogarty, Dr. Centric, Dr. Renza, Dr. Spear, Dr. Burgess, Dr. Rodriguez, and Dr. Ortel. Dr. Octavani has been a regular here. John Swartz from Pharmanex has been a big supporter. Dr. Ching. Kate, I think, is new. And Dr. Khan, I think, is new also. I think he might have been here once before. And of course, the ringleader here is Dr. Halassa. I'm surprised he didn't hop on and want you to, press you about, the cytokine outcome of
activation cascades.
Some of those exercises that you showed. So
yeah.
He might be playing soccer. Every once in a while, he's out playing soccer at this time. So
that's good. Nothing wrong with staying active.
Okay. I think I can acknowledge everybody but Kathy. So Kathy, thank you for being here. We will be here again next week, same time, same station. Anybody wishes to present anything, please let me know. We will, as always, have, if it's okay with you, David, we've recorded this and we have put it up on our website. And we have quite a content. We've been doing this for a little over a year now, and we have developed quite a nice video content. If it's okay with you, we'd like to put yours up also. Yeah,
that would be awesome. Thank you.
And please stay in touch. We'll certainly want to have you back and tell us about your progress. And anybody have any questions, comments? I was at AMMG this past weekend. I spoke on low dose naltrexone and on hair loss, and it was allegedly well received. I don't like to pat myself on the back, but I've gotten a lot of emails from participants, and we've stirred up some interest in our programs, in our program coming up in March. Please bring bring one friend with you so we can expand our little family here. Okay. We had a pretty good turnout tonight. We had 26 or 27. I think our record's 30. So we're getting there. Okay. And anybody else have any questions, comments? David, thank you so much.
My pleasure, Bill. Thanks. You got a great group here.
Okay, thank you so much.
I look forward to seeing you guys again.
We have a terrific program, and please stay in touch and keep us informed of anything that any new developments. And we'll certainly want to have you back, at some point, sometime in the future.
Yeah, I'd love to. And John or anyone else, please reach out to me. I'd love to discuss some things further. Working together, I think we can make a bigger impact on patients. So that's what it's about.
We have David's contacts in the chat room, and I have them also.
Cool.
Okay.
Awesome.
Okay.
Thank you.
Good. Thank you.
Have a good night,
everybody. Yeah. Okay. And Dr. Ching, yes, I will talk to you after the meeting. Okay. Thank you so much, everybody.